My name's Ruby, it's the 10th of May and I'll be performing a packed cell volume and total protein test on this blood for ACM Vet 403 simulated practical. I used a 1 ml syringe to take blood from a 22 gauge catheter on a dog in the cephalic vein. And the catheter was placed because the animal was having surgery and we just needed easy access to the vein for medications, fluids and blood samples. I took 0.5 ml and placed it in the EDTA tube to prevent it from clotting because I can't use clotted blood for the PCV test, it doesn't work. So I'll be using the blood from this tube. I've labelled the tube with the animal's name, their date and the patient number. So to perform the test I need sorry, I'm sick. I need microhematocrit tubes. I need the Critoseal, the clay, to plug the tube. I need a centrifuge, which is in another room, I'll show you later. I need the refractometer for the TP and also the reader to read the PCV and also some cleaning stuff. So, using the end of the microhematocrit tube that doesn't have the blue line on it, so the opposite end, I'm going to open the top of the tube and just on an angle place the end into the blood and it will automatically fill with the capillary. You want to fill it about 3/4 of the way. You don't want to fill it all the way because you won't be able to read the blood using the top of the serum. Just put like a little bit more in there. There we go. So because of the centrifuge I'm using, I have to put a lot of clay in this. So I just have to stab it lots of times. That should be enough. Okay. So I also held the end of the tube after I took it out of this to make sure the blood didn't fall out before I put it in that. So now we're going to take it to the centrifuge. We have 2 centrifuges in this clinic. One has an automatic set timer for microhematocrits, but we don't have the attachment for it, so we use this one, which is actually for QBCs. It's not made for microhematocrits. It has a set time, so I can't change the time on it, it just runs, but I do believe you need to run these for at least 4 minutes. This one is really noisy and loud, but unscrew the lid. I've already got 2 that I've done earlier, just so we don't have to sit here and listen to it. So normally you just put 1 either side. You need 2 to balance and also 2 to test it against each other to make sure you're getting a similar test result. If you're not getting the same result, you're doing it wrong, you need to do it again. But you would put them in straight across from each other to balance it with the clay facing outwards, put the lid on and screw it tight, close this lid and turn it on, and then it would go whoosh. So we take our 2 tests back into this room. So you can see here they're pretty similar in result with the line. So we'll just do one first. So the first one we've got, you're going to line the clay up, the bottom of the clay or the top of the clay with the bottom line and the top of your plasma with the top line. And then your reading is going to be the Buffy coat there, the line in the middle, which is about 47 or 48, which is good. Normal ranges for a dog are about 35 to 55. I'll just double check this one. So same thing, and we've got exactly the same reading, so I've done it right, which is always good. So now we're going to do the total protein. You need the refractometer. You just break the end off the. So I do it this way. You break the end off the hematocrit tube where the serum is. So just a little snap and pop that in there. I don't tap it onto here because you can actually damage the screen of the refractometer, and it makes it really difficult to read things. I didn't just put that in my mouth. So take the end of that, and what I do is just pop it over the refractometer, and with my needle I'm going to push the clay down, and it should push some of my serum out. There we go. There, that should be enough. So just close the lid on that and hold it up to the light and read it. So I've got about 7.2, which is also good because your normal ranges, depending on the patient, are about 5 to 8. So just to clean it, use a damp Kim wipe and a dry Kim wipe and just wipe it off. Once I'm finished, I dispose of all the sharps in the sharps bin. Put everything in the rubbish that needs to go in the rubbish. So I record my values as well, which was 48 and 7.2. And I can go back in there. So that's on her chart, and I'll also record it on her record on the computer. I put everything away. I spray everything down with the F10 and wipe it. The blood goes to the pathology area, and it's already got her name on it, just in case we need to do any more tests later. Put my gloves off and just clean with an antibacterial soap.